Okay. Well, welcome everyone. Our Region 7 Presents topic for today is building recovery through community. Thank you for being here. My name is Benny Finch, and I am one of the education and outreach coordinators in Region 7. So I briefly want to introduce the network of the National Library of Medicine, also known as NNLM. The NNLM regional medical libraries are funded by the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. Region 7 includes these states in the top right of the map: Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. Our office is located at the UMass Chan Medical School in Worcester, Mass. And we're also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. In today's 1 hour panel presentation, participants will learn about the work of 2 organizations in support of recovery. Riverbend Director of Recovery Support Services and Project Lead Rich Hollett will describe their NNLM-funded project Recovery Capital Investment. And Emily Martin, Adult Services Librarian, will share about the Read to Recovery project at Saratoga Springs Public Library and discuss the impacts of this pilot project and partnerships developed in the community through this work to support recovery. I'll also share some resources from the NLM and NNLM at the end. We acknowledge that some conversations and topics can be difficult and may bring up your own experiences, so we encourage you to take care of yourselves. If you need to excuse yourself, please do so. So now I would like to formally introduce our presenters. Richard Hollett, CARC, is the Division Director of Recovery Support Services. Starting at Riverbend as a recovery coach himself, Rich played an instrumental role in building the Recovery Coach program, bringing Recovery Cafe to Lowell and a second Recovery Cafe to Haverhill, and developing CCAR's Recovery Coach Academy at Riverbend. Rich leads with his heart, guided by lived experience. Excuse me, he champions healing through connection, love, and compassion. Rich's personal and professional experiences have informed him that love and its restorative impact is his most valuable resource. He recognizes the profound benefits of being known, valued, and loved, and the suffering that comes from their absence. He is a true force for change within the field of addiction treatment and recovery so that perspectives evolve, biases dissolve, and services are delivered with the love, compassion, and dignity that every human being deserves. Emily Martin has been working in public libraries since 2011 and is now an adult services librarian at the Saratoga Springs Public Library in upstate New York. She is passionate about creating library services that bring visibility, support, and compassion to individuals navigating often unseen challenges, such as grief, recovery, mental health, and more. Outside of work, Emily is dedicated to her fearful rescue dog, Buddy, and volunteers as a librarian sleuth to help investigate unresolved homicide cases. We will start with 2 brief presentations from our panelists, then we'll have time for Q&A at the end. So again, please add your questions to the chat throughout the presentation. We will hold all questions until the end of the presentations as we're reserving time for that. And I will now pass it over to Rich.
Hello, everybody. It's very nice to be here with you all. My name is Rich Hollett. I am the Director of Recovery Support Services for Riverbend. I'll briefly explain the funding that we use. Well, first of all, I just want to sincerely thank the network of the National Libraries of Medicine for the generous grant awarded to Riverbend. Recovery Capital Investment was the name of it. We're so surprised and pleased with how impactful and meaningful this funding has turned out for us. Like, we didn't expect it. We knew it was important, but we didn't expect it to be quite so impactful and meaningful. So when I say that, I'm not just saying it. I genuinely mean from the bottom of my heart, thank you. And as I go through the slides, I'm hoping it'll help you understand just how impactful it's been. So having said that, the funding has allowed us to grow from 4 Recovery Coach Academy facilitators to 7. And therefore, we've been able to increase the number of Recovery Coach Academy trainings and the participants in attendance. All of this has had a meaningful impact on the communities we serve. We are a very proud partner with you and deeply appreciate your belief in our mission. And again, the going from 4 to 7 facilitators. It's actually this is a typo. As I'm reading it, I'm realizing it went from 3 to 7. We had 4 new recovery coach. Yeah. So originally it was really just 2 of us that were teaching these recovery coach academies. It's a 5-day, very intensive program. So we couldn't do it all the time. Every time we did it, it was me and Gianna. It's our most favorite part of our job, but we couldn't do it that often because we just got a week behind because both of us oversee a division and it was something we wanted to do more of. And so the fact that now we have 7 recovery coach facilitators allows us to have them more often. And when we have them more often, we're actually hiring from the pool of participants, and other programs and providers around us are also hiring. And we've been able to, I'm just going to give an example of one super meaningful training we had. We were able to train the staff at an emergency department here in Lowell, Mass. And they really needed to, they were just an overworked ED and they didn't necessarily have any training in how to interact with people with substance use. So this training is very interactive and engaging, and the entire ED has changed from the experience of them being trained in the Recovery Coach Academy. And now we have a recovery coach that's in the ED doing work and really influencing people. So again, I can't say enough how meaningful it is. Next slide, please. So recovery support services. Riverbend's recovery support services are a non-clinical, recipient-directed and delivered by peers who share life experiences with the recipients they are serving. So the programs I oversee are Recovery Cafe Lowell, which is a peer recovery support center, Ray of Light Recovery Cafe in Haverhill, another peer recovery support center, the Recovery Coach Academy, and Recovery Coaching. Next slide, please. Oh, you can go to the next one. Thank you. So I'm giving you we love this definition, not necessarily for the meaning it had back when it was written, but because what it means to us now. The very first use of the word coach in the English language occurred in the 1500s to refer to a particular kind of carriage. Hence the root meaning of the verb to coach, to convey a valued person from where he or she was to where he or she wanted to be. One of the things that being a recovery coach, sort of the foundation of being a recovery coach, is recognizing the immeasurable value and potential in every human being, regardless of substance use, mental health, homelessness, justice involvement, or just mistakes made. Like just really holding that belief and that energy when you're interacting with someone who often feels at the worst time in their life, when they're just filled with shame. Just being with someone who sees the potential and value in them can be really profound. Another term, part of the Recovery Coach Academy training and part of the industry, is recovery capital. It's the breadth and depth of internal and external resources that can be drawn upon to initiate and sustain recovery from substance use. My simpler definition of that is anything internal or external that inspires, motivates, or supports someone's recovery. Next slide, please. So I'm going to just briefly go over the impact of the Recovery Coach Academy. This framework highlights how the Recovery Coach Academy also ultimately impacts individual systems in the broader community by training and empowering recovery coaches. I'll read these through quickly. It expands access to support, it strengthens the recovery workforce, upholds the value of lived experience and relatability, enhances public health and safety, creates leadership and advocacy, includes the compassionate, inclusive approach, builds recovery-oriented systems of care, reduces stigma, and it improves individual outcomes. Again, one of my favorite parts of being a recovery coach and teaching or facilitating the Recovery Coach Academy is I can see how if someone, regardless of what agency someone works at, they participate in the Recovery Coach Academy, and then they go back, return to that agency. They inspire people who aren't necessarily going to be recovery coaches. Often we even have clinicians, and we've had doctors and nurses and security guards and policemen and firemen in the Recovery Coach Academies. But it just sort of opens people's eyes and opens people's hearts, really. So when they go back and work in when they return to their work, they have a inspirational impact on their whole team at work, and it just changes the whole work environment and changes the impact that those individual providers have on the clients they serve. So next slide, please. I'm going to just go over there in terms of strengthening the recovery workforce. Training and certification produces qualified, certified recovery coaches prepared to serve in diverse settings. Employment pathways creates new job opportunities for people with lived experience. Professionalization raises the profile of recovery coaching as a recognized, evidence-informed profession. Expanding access to support, peer-based care provides more trained peers to walk alongside individuals at all stages of recovery. System navigation bridges gaps between clinical treatment, mutual aid groups, community supports, and social services. And that's a meaningful thing. Like oftentimes when people either get out of jail or get out of treatment, there's a huge vulnerability at that point, and the recovery coaches are known to the jails and to the treatment providers to be the buoys, so they can get through that vulnerable time when they're not in such a structured environment. Accessibility ensures individuals can find compassionate support outside traditional treatment systems. Improving individual outcomes, motivation, and empowerment. Recovery coaches inspire hope, self-worth, and resilience. Sustained recovery, ongoing peer support, lowers relapse rates and increases engagement. Whole person growth encourages self-determination, community connection, and personal development. Next slide, please. Reducing stigma, normalizing recovery demonstrates that recovery is possible and diverse. Everyone in all of the programs I oversee have some combination of lived experience with substance use, mental health, homelessness, criminal justice involvement. And that relatability factor is very powerful. Like it's easy to see the potential in someone when they're at their worst, because we've all at one time at our worst, and now here we are living a meaningful, purposeful, fulfilling life, and that relatability factor is very important. Community education, graduates serve as ambassadors who shift public attitudes. Inclusion and dignity centers compassion, acceptance, and human worth. Building recovery-oriented systems of care. I'm just going to jump in and say one of the things we're also known for as recovery coaches is we're not pathology based, we're recovery based. So we don't diagnose, we don't really even enter that clinical lane. We're 100% focused on recovery, the here and now, and moving forward. And we've been able to influence, like I said before, emergency departments, criminal justice systems, treatment providers, in collaboration, creates integrated person-first systems of care across institutions. The compassionate, inclusive approach, meeting people where they're at, very important. When we come across someone, regardless of how they're presenting, we're going to see the potential in them and the value in them, and meet them where they're at, where they are, and find out where they want to go and help them get there. Recovery coaches honor harm reduction, abstinence, or any chosen path of recovery. we're all multiple pathways. We don't, just because one of our pathways as a recovery coach is one thing, we don't impose that on them. We want to help them identify what motivates, supports, and inspires them. Upholding value and potential affirms every individual's dignity, regardless of substance use, mental health challenges, justice involvement, or mistakes made. Love and action centers compassion, acceptance, and dignity as guiding values. Next slide, please. The value of lived experience and relatability, authentic connection, shared lived experience builds trust, safety, and relatability. Again, that's a super powerful component of people with lived experience. Hope through example, coaches embody recovery, making it real and visible. Relatability across systems, credibility in EDs, courts, and treatment centers strengthens client engagement. Community culture shift reinforces the truth that people are defined by potential, not past mistakes. Leadership development, alumni often become trainers, advocates, and system leaders. Enhancing community well-being, safer communities, decreases overdoses, ED visits, and criminal justice involvement. Economic impact increases workforce participation and reduces reliance on social services. Social cohesion builds networks of belonging, acceptance, and resilience. Creating leadership and advocacy. Empowered alumni, graduates often step into leadership and policy roles. And and I'm not bragging when I say this, but it feels. I started out as a recovery coach, not making much money at all, and that was 8 years ago, and so now I'm a division director, and that's awesome for me. But my favorite part about it is when I hire recovery coaches, I let them know that I'm just a reflection of them. They too have the possibility of if not, especially the younger ones, the younger generation, as far as I'm concerned, more evolved and smarter than I am. So I love them to see, to sort of hold on to an image of themselves, and they can use me in that process if that helps them. But I love that they get excited about working in the field. And I have a few people that literally say they're after my job, and I'm like, I'm on your side. I'm rooting for you. Peer-led innovation sparks new recovery cafes, harm reduction initiatives, and support networks. Amplified voices ensures lived experience, shapes community health responses. Recovery coaches are also fierce advocates for recovery. Like, it's a little delicate to explain because unlike other treatment providers, we line up with the client, or we call them the recovery. That's who we're lined up. Like, for example, if someone's on probation, we don't line up with the court, we line up with the client. We don't line up with the treatment center, we line up with the client. Which ultimately, it's taken me a long time to train people to understand this, meaning the treatment centers and the courts. But if someone gets kicked out of a treatment center, then I'm going to be lined up with the client, not the treatment center. Otherwise, I'm not going to be available. They're not going to want to call me if I've conveyed somehow that I'm on the side of the treatment center or the PO. And even the POs now appreciate it, because at the end of the day, anyone who works in this field, including the probation officers, they want what's best for the client. So them knowing that if they're in some sort of trouble, me working with them and supporting them and encouraging them to talk to the PO, that's an important component. But we are very much aligned with the client, not the system. I totally lost my place. Peer-led innovation sparks new recovery. Oh, I said that already. Amplified voices ensures lived experience, shapes community health responses. Next slide. The Recovery Coach Academy creates ripples of impact, transforming individuals, strengthening systems, and reshaping communities through lived experience, relatability, compassion, and inclusion. Recovery Coach Academy graduates shift cultures, reduce stigma, and build a recovery-oriented future grounded in dignity and love. Next slide. Guess that's it. Just to finish off, and we're certainly open to questions at the end. I love being a recovery coach, even though I'm a division director now, I still sort of cheat the system and I still work directly with some clients because it wouldn't feel right for me not to. And I genuinely believe, if not know, really, um, that the presence of recovery coaches within all systems of care is so needed, not just directly for the clients we serve, but for the other providers who are also serving them. To be able to recognize the value and potential in someone and uphold that in our interactions and focus on their strengths. I have had experiences with recoveries that when they've told me their story, it mesmerizes me that they're even able to be standing in front of me. Like what they've been through, I don't know that I would have survived it. Um, so recovery coaches develop a habit of setting aside their initial bias or the initial perspective of where someone is and puts that on hold, knowing that there's a story that supports and makes it understandable why they're in the condition they're in and why they're even behaving the way they're behaving. If we could each see a story of each other's lives all the time before we jumped in and judged them, most of us would be in a puddle of tears instead of being annoyed with people. um, anyway, that is my story, and I'm sticking to it. Again, thank you all so much. I cannot tell you how much this has impacted our community in so many different ways. There's not enough words to describe how helpful this has been and how meaningful it's been. So thank you. Thank you.
Thank you.
Thank you. Thank you.
Thank you so much, Rich. And it's been a pleasure to, watch the work over the past year and to see these ripples and all these impacts. So I look forward to having time to ask questions and hear more after Emily's presentation. But for now, I will pass it over to our next presenter, Emily Martin from the Saratoga Springs Public Library.
Can you hear me okay? Awesome. Thank you, Benny. My name is Emily Martin, and I'm a public librarian in Saratoga Springs, New York. I've been in my current position here about 2.5 years, and I wear a lot of different hats, so no day looks the same here, but I'm usually bouncing between like the reference desk or a program or doing a display or ordering books. And this is a new collection to the library that I brought here about a year and a half ago. The topic of recovery is very personal for me, so I probably should disclose that any opinions I have are a reflection of myself and not the library. We could go ahead and go to the next slide. So a little bit about us. The Saratoga Springs Public Library serves just over 110 square miles and has about 55,000 residents. Our building is located in downtown, and to extend the reach of library services, we have 2 different outreach librarians to bring services to rural populations and homebound populations. And like most communities, our library is one of the last places to really exist without a valid reason. We're considered a safe place for so many people in our community, and it makes sense. We have long hours, kind staff, comfy chairs, computer, shelter from extreme New York weather. And we're also a trusted source of information, and we don't judge. So we're sometimes put in a position to answer higher stakes questions. Here in Saratoga, it's not uncommon for us to assist someone who falls through the cracks when it comes to housing, healthcare, and employment. We know what it's like to not get a good night's sleep or have access to a shower or meal, or if you struggle with a mental health or substance use disorder and don't have that support network. So we know it only really takes one stumble to get you down so bad that you don't know really where to turn. So you could go ahead and click the next slide. I'm going to talk a little bit about our community health data, and then I won't really talk about stats after this. But since 2018, our health department has been keeping track of fatal and non-fatal overdoses in our county. Right now, we're increasing at a pretty rapid rate. You could kind of see like that steady incline. Right now, we average about 3 non-fatal overdoses a day. And that's kind of a scary number that tells us that the risk of experiencing, witnessing, responding to an overdose is pretty high, or knowing someone who has. Um, and for context, our population is about 240,000. And that last number, that was last week, it has since gone up to over 1,100. We could go to the next slide. So this slide shows drug-related overdoses that were fatal. And you can see that those are increasing, which is good news. And we really credit that to the increased access to harm reduction in our community, and more members stepping up to get training and learn how to recognize and respond to an overdose. So a big shout out to our health department who may be on this meeting. So they work really hard to raise awareness and offer trainings and distribute as much harm reduction as they can in an effort to save lives. And I'll give a couple of examples of how we partner with them. But since they've started keeping track in 2018, the number of people we've lost in our community is just under 300. And those are 300 losses that have impacted our friends and family and colleagues and neighbors. And if you have lost a loved one to the result of addiction, overdose or not, you probably know what that shame and stigma is like that follows. So that feeling of being alone on top of tremendous grief and even guilt is something that no one should have to experience. Go ahead and go to the next slide. So I referenced harm reduction a few times, and I do just want to clarify that I'm referring to the fentanyl and the xylazine test strips and the Narcan nasal spray. I'm in New York, so those are both distributed for free here, and I don't believe that's the case in every state. So you would have to check locally. Um, I'm also coming from a place of believing strongly that harm reduction offers compassion and hope for people who engage with drugs. It keeps someone alive so that they have the opportunity to find recovery, because we know it often takes more than one attempt. Um, and since public libraries offer compassion to all humans and work to meet the needs of all members in our community, I feel like we have this unique opportunity to give more visibility and resources to those who need it most, because I feel it's literally life or death. And I talk about this a lot, so I understand if it feels like a radical idea. But if you work in a public library, I want to encourage you to think about how you determine what services you offer. For example, did you give away COVID tests in the height of the pandemic, or eclipse glasses during the eclipse? So stigma aside, is harm reduction really that different? Um, on this slide, you'll see two examples. So we've got like that purple newspaper stand. So an example of passive and hands-on. That newspaper stand makes an appearance for big events in town. So our city population pretty much triples in the summer between our racetrack and concert venue. And it's kind of like a risky culture that glamorizes gambling and drinking. We've got about a dozen bars within a 1 block radius of the library. Um, so I really love this stand so much because it's way less intimidating than the public health nurse with the bulky law enforcement dudes, who are actually some of the nicest people, but I totally understand if you wouldn't want to share space with them. It kind of feels like outing yourself in some way with drug use or someone you know, even though that's not always the case. I think it was back in 20, the FDA is actually recommending that any patient prescribed a prescription opioid pain reliever to consider keeping Narcan in the house because of that increased risk. Um, and one note about the tabling, my family, like I'm a crier, so I don't like to get into details, but my family has had tremendous loss. So when I participate in something like this, I see and I know that pain firsthand. Um, just the visibility and offer of this often brings up a lot of strong emotions. That particular day, and it wasn't the first time I heard it, someone got upset, if only we had this maybe 10 or so years ago, maybe my child, parent, sibling, partner, friend would still be alive. Um, so you could go ahead and go to the next slide. I'm going to close out of my email. There we go. Okay, so we made it. So this is the Read to Recovery collection, kind of going back to that idea from a few slides ago, the foundation that public libraries are built on being a welcoming place that offers a lifeline to resources without cost or judgment. We decided to curate this permanent collection of recovery-based literature that is free to keep, no questions asked. So this launched last May. It's an entire row discreetly located on our second floor, kind of within the stacks. It's browsable, offering our community low barrier access 70 hours a week. And, we believe that just the offer and visibility of this in our space creates a direct pathway for anyone affected by substance use disorder and essentially serves as a bridge to additional community support systems like mutual aid groups. Here we have a recovery outreach center, probably much like where Rich works, where we are able to make referrals. So our hope is that it makes navigation a little bit easier, especially for those who don't know where to start or maybe in crisis mode. Um, and our collection has actually grown quite a bit since this photo. We have tons of handouts and brochures on everything from navigating healthcare to domestic violence and crisis support and suicide prevention. Most of the titles there are literature from 12-step programs. I really like what Rich said about multiple pathways. We have a lot of pathways. So we've got Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous, Sex Addicts Anonymous, Codependents Anonymous, family support group books for Nar-Anon, Alateen, Al-Anon, adult children of alcoholics. We recently added smart recovery, grief support we've always had, spirituality, mindfulness, disordered eating, mental health, and trauma recovery, because we know there's a lot to recover from. When it comes to like the collection development part, we did seek guidance from members in the recovery community to make sure we were on the right path. My mom is one of them. She's been in recovery for 36 years. So she was kind of my point person. And our local recovery outreach center, Healing Springs, they're great and will also supply us with books. We also welcome feedback, and that is how we've grown to about 60 titles in a year. But none of this would be possible without an NLM who kickstarted our collection with a $5,000 grant. And we were able to build the evidence that we need to snowball it into seeking other grants and connecting with a librarian named Doreen in San Francisco, who started the first Read to Recovery collection out there in 2021. Okay, so I think we could go to the next slide. I do just want to show you, we also keep harm reduction on the shelf here, free to keep, no questions asked. There's a QR code you could scan for training. You could also hopefully see that we have shelves dedicated entirely to like family resources, youth, problem gambling, and grief support, which is actually our number one topic of books that go, because that's so universal. So many of these topics are interconnected, so we try to offer something for everyone. All right, next slide. Hopefully I'm not talking too fast. I just got a lot to get through. Accessibility is a huge concern. So we have this little mini collection that's on our first floor main entrance. When our elevator broke, we decided to put that there, and I find myself having to constantly restock that. We also keep a limited number of the 12-step program books in CD audiobook, large print, plain language, Braille, American Sign Language, and then we have 5 languages, so Spanish, Ukrainian, French, Chinese, and Korean, which are the top 5 languages in our English language learning program. All right, so I can go to the next slide. So outreach, according to SAMHSA, community and education are vital tools in the prevention and treatment of substance use disorders. but between shame and stigma and even maintaining anonymity, it's not really a topic of conversation. So if we're not talking about it, how do we address it? Um, in our experience, the best way to do that is through outreach events to meet people where they are. And this is how we have engaged with hundreds of people in the community, and they're always really shocked but grateful that the library could be there in a way that they never expected. This is my coworker, Mary. She's amazing. She couldn't be here today, but we go to some heavy things like the overdose awareness vigil and the annual suicide prevention walk. And we give out all of the books there. And we could go to the next slide. So we also have this outreach van, which is really cool. And it travels with the mini Reach Recovery collection to pop-up events at like the farmers market or a community center that serves a rural population. Here we are at the Pride Festival. And on the right, you could see a cart that we used during a library program that was promoting advocacy and raising awareness to the cuts of IMLS. And this was a really exciting moment to me because everyone was kind of asking, like, how did these cuts to federal funds trickle down to the public library? And I'm like, this is exactly it. Um, we can go to the next slide. So here are some insights for the first 16 months since we've launched. We've raised just over $20,000 in grants and donations. I want to say we've given away over 1,000 books at this point. I haven't done inventory in a while. And, just the scope of the collection has grown tremendously. But I really think that the most impactful part of this entire project falls under like the very last bullet, countless interactions. But those can't be easily measured or shared in a way that's ethical for privacy reasons. But it's really like the human connection, the tears, the hugs, the validation, the support, and the referrals that make it all worth it. We could go ahead and see the next slide. The next slide shows the top 10 items that people take. So that includes AA books, Living Sober, and the 12 Steps and 12 Traditions, a Buddhism book, One Breath at a Time, but that's also based in the 12 Steps. You'll also see a couple of children's picture books on grief support and more grief support on top there, and the Narcan nasal spray. So we could go to the next slide. And since the launch, we've really been able to expand the scope of the programs that we have here. One of my favorites is the Social Connection, a new chapter book group, which is in partnership with our local recovery outreach center. So we're able to bring a peer navigator into the building to create a safe space for those in recovery at the library. And also the peer navigator support, much like what Rich is doing, we're bringing in peers to offer services on a drop-in basis because we know that shared experience is really important. Go to the next slide. This is my last slide, and my whole, I guess, mission in this is hope. That always comes up as our theme. And my hope is that if you are in a library, or if you want to see your library do something similar to maybe encourage them incorporating more recovery-based services in whatever way that works for what works best for them. And I think we're going to talk about challenges a little bit later. But that could mean adding like a few books to your circulating collection or reaching out to a community partner like Rich's and invite them into the library to host a program. So it all starts with awareness, and that's why I'm so grateful to Benny and NNLM for hosting us today to talk about recovery. It's such an important topic. And thank you for listening with an open heart and mind. And I think my contact info is on the next slide because I'm always always down to talk about it.
Sorry, I thought I would just leave it here for a second in case people want to take note, but we are also going to provide a link to the slides later on, so you'll have access to this information. But now we are going to take some time for Q&A. Thank you so much, Rich and Emily, for your presentations. We do have some time for questions. Attendees, continue to add your questions to the chat. I had a couple of questions I wanted to start with, but I also just had a couple of, just in hearing your presentations, I really appreciated um, the title of your slide, Emily, measurable benefits. It's wonderful to see these measurable, but I think as Rich was talking about too, we see these ripples that we don't see all of the longer term benefits, like when someone in an organization brings back their knowledge and um, frame of reference to their organization. Um, and okay, I'll stop for there. But so I would, it would be helpful if one of you or if both of you could each share something that you did find challenging in your projects.
I could go first. Um, so I recognize that like time is huge, space, money, but there's also like this emotional weight that comes to it. And those aren't really challenges, but there may be barriers to other people who are interested in doing this. I'm very lucky to have like a library that very much supports this and wants me to spend more time investing in it. Oh, and grants, funding.
No,
Funding.
absolutely. Having all those.
Number one challenge. Yeah.
For us, the biggest challenge was when we received the funding, CCAR, the organization that hosts the training, the facilitators training, it's the CCAR model that we teach. It's the Connecticut Community of Addiction and Recovery. They were in the process of converting the criteria for the facilitators, so it got a little complicated, and it just caused delays. That was the only challenge we had.
And just um, in the handout that we're going to share, there's a lot of information about the programs that Rich is talking about included in that handout. So I just want to make sure you know that to look for those links to more information about CCAR and the other. And maybe, Rich, you want to say anything about those resources now?
Yeah, I mean, a lot of it just goes over the Recovery Coach Academy, all the modules, and a description of the Recovery Coach Academy and the certification process here in Massachusetts. But the CCAR is a national model, so most everywhere would hopefully follows the CCAR model. And then, yeah, I think most of it is really just about the Recovery Coach Academy. It goes
Okay,
over the whole thing. Yeah. I'm not sure if Nicole gave me all the attachments she sent, but the other one is
okay,
just really more information about the programs that she and I oversee here at Riverbend.
great. Thank you very much.
Sure.
And also on that handout, you can look for a LibGuide from Saratoga Springs Public Library as well. So I just want to mention when you get that handout, look for those things.
There's
Um,
also, sorry,
no, go ahead.
I'm recalling now, she's also got a brochure that gives more in-depth explanation of what recovery coaching itself is.
Um, if ask if each of you could share about what you found most rewarding, and then we'll go to questions from the audience.
I think, Benny, the first time I met you, I described this collection as my own personal trauma response of not being able to help others. So the most rewarding part of it is a little bit personal, but also all of the interactions that I have with people who share personal stories about their history, how helpful it's been. I've made a lot of really great relationships and heard so many good stories from staff. I've had people write me from rehab and jail to let me know how they're doing. So it's so great to have that like social connection and be able to share my own story too.
So I had never planned on coming into this field. I was actually pursuing restorative justice, restorative principles, and I hit an acronym that was apparently I hit CCAR instead of the acronym I was looking for. So this Recovery Coach Academy presented itself, and I didn't really want anything to do with the field. I didn't even really want at the time. I was in recovery, but I was I wasn't really part of the recovery community. Um, so when I read it, I was like, oh my gosh, where was this when I was looking for support? Like I literally read the explanation for CCAR and felt like someone downloaded my brain. And so I got into the Recovery Coach Academy, and then I ended up becoming a facilitator, and I facilitated for years here at Riverbend. So even though like intellectually, it seemed like a great idea to increase the number of facilitators, and it was, just to be clear. But I had my own little letting go process of that because I loved it so much. It was really one of my favorite, if not my favorite part of my jobs. So I had to allow other people to step in and do that. And in letting go and allowing that to happen, I saw how much more impact we could have on the community. So that to me is just so fulfilling, and I love that. So, but it did require a little letting go on my part, which is usually a sign of something good.
Margot, do you have any questions from the audience?
No, there aren't any questions in the chat right now.
Okay, so this is your opportunity, folks, to still add some questions, but I have, um, I think people probably heard this, but I've talked to both of you before about like the community impacts and just the community involvement. And I appreciated, Rich, what you had, sharing about um, being in line with um, the person that you're supporting and how that is meaningful to organizations who are also that you're working with or the folks are working with. And could you talk a little bit more about the importance of kind of being embedded in the community?
Yeah, for the most part, people who we the Recovery Cafe model and just being in Lowell, Massachusetts, a big portion of the people we serve are homeless. So they're dealing with stigma and marginalization, and they're so in survival mode. And so when they're in a treatment setting, for example, um, they're expected to, they're in a structured environment, they're expected to follow the rules, which is understandable. But at the same time, it can be a big leap for someone to, as an example, smoke a cigarette in the right section, or or to or to even be respectful, frankly. Like they have so little respect for themselves for them to be expected to, be perfect. They and they need an experience. They need that, there's something that's going on with them that they have as much potential to be respectful and follow the rules as anyone else, but they don't necessarily have the experiences that some of us have had to get us to that place where we understand it and we have, good role models, whatever the case may be for someone. So oftentimes the system, without meaning to, like for example, treatment centers, DCF, the court systems, they don't realize that. So they just treat them sort of all the same without meaning to, and they hold people to whatever the universal rules. So they're often, they get kicked out or they get in trouble. So us lining up with the client helps them become the person that they need to be just to get through the system and hopefully up and out of the system. That's the ideal for people. The system, let's face it, it's a broken system. Sometimes it's necessary, but it comes with some issues that aren't necessarily, they don't necessarily embody or they don't implement what some human beings need in terms of like flexibility and understanding and compassion and person-centeredness and really truly meeting people where they're at. So yeah, I don't even remember what question was at this point, but I just know that that to me, the impact of recovery coaches and what we learn at the Recovery Coach Academy, what's espoused at the Recovery Coach Academy has been such a soothing and inspiring effect on people, including the people that that are part of the system. Like it's changing the system, which is really nice. Because if someone, for example, the ED recovery coach, he's in there sitting bedside, holding someone's hand, interacting with the person that 20 minutes ago the nurse was interacting with, but the client was combative with the nurse. And everyone's looking at him like, how does he do it? How does he do it? Like he's like the doctors go to him now, excuse me, for advice because he has such success in even placing people and interacting them with the patients. I'm not used to saying that word because I don't work in the ED, but interacting with patients in a way that produces a next step, a detox or a treatment, some sort of next step. Usually they end up leaving, just without medical clearance. So like that's the impact that I'm so proud of and so inspired by. It's really amazing to me.
That is really inspiring to hear. And yes. Emily, I know you've also had the opportunity to get to know a lot of community partners, and I was just wondering if you could share a little bit about that and how that impacts your work in the library.
So Rich just reminded me, I work closely with the Healing Springs Recovery Outreach Center, which is about a quarter mile away from the library. They serve all of our county, and they've grown from, I want to say, 7 to 14 or 15 peer navigators in the last year. There's definitely a demand. And in our collection, I'm able to keep business cards, and they kind of each have different specialties. There was one day we were closing the library and we had someone here who was intoxicated, and I didn't have the heart to ask him to leave because it was freezing cold outside and it was going down to whatever that night. And he said the only way that he survives at night is to use and keep moving so he doesn't sit down and freeze to death. And I said, well, I know this person at this center and he's great. And here's his business card. You could literally text him and arrange a ride down to rehab right now. He's like, yeah, I know that. Not right now, but thank you. And I brought him over to the collection. I'm like, whenever you're ready, like at least take some test strips with you if you are going to use. Like, I'm not here to judge you. And he's like, oh, this is great. So there are like tiny ways to plant these seeds. And it's more of like I think there's a lot more weight that comes with a referral when it's like, I know this person, like they're really nice. They will do this for you. I'm not just going to give you a phone number and tell you like good luck. Like I'm here to tell you what you could expect. And just before the launch of our collection, staff here responded to a woman who was overdosing in our restroom, and she was Narcaned twice and was conscious when she left. And it was the first time I ever thought, what happens to someone after they're Narcaned? And I found out there's someone full-time at Healing Springs who is in the emergency room department, who follows up on every single person that comes through and works with another organization that will help someone if they're in like an unsafe situation with a partner. And I'm like, oh, thank God. Like I was thinking, she's gonna go and she's gonna go right back out and she's not gonna know what support systems are out there. But there are people there waiting. So these organizations are doing really, really amazing work. And I felt like I didn't have to worry about her because I knew that she was going to be cared for after she left the library.
Thank you. And, you know, I'm hearing both that it gives you comfort to know that there are good folks out there that are helping, but also by knowing people, it makes it a lot easier to do an introduction and know that they're going to be received well. And so, Margot, do we have a
Benny,
question?
yeah, we do have a question. So somebody has said that just recently moral injury has been added to the recent DSM. So do either of our speakers have any thoughts on that or how it might fit into a Read to Recovery collection if you're aware of that?
Yeah, I did see that question come through and I sent her a quick chat. I definitely think that topic falls under trauma recovery. And I remember the first time I heard the word moral injury and knew exactly what moment in my life at my previous job that happened to me. So I'm definitely going to research potential books to add to the collection.
Thank you.
I've personally not heard of it, so now I'm super curious. I mean, we're not clinicians, so we don't necessarily follow the DSM, but but I'm still very curious, and I'm gonna find out.
Yeah, it's like the straw that breaks the camel's back, that kind of like functioning at, up to here and just one more thing will set you over the edge and just kind of break you.
Yeah, I think I
Thousand
like
paper
Rich, I
cuts.
was thinking, it has almost a judgy kind of ring to it. So I'm curious about learning about it.
Yeah, no, I'm curious about it too. Yeah, I think when you said that, when Emily, when you explained the definition, that has happened. Like the Lowell General Hospital has a history of, I've never heard that term be to it, but I've had clients who would literally rather die than go to the emergency department. They just can't take one more second of being looked at with such disgust or with such judgmental eyes. Which to be fair, has since been turned around to an unbelievable level. So I'm reaching back in the past. But I think, yeah, I think that when I look it up, I feel like that's gonna come to mind for me. Those people that just don't have it in them to have that one last straw that broke their back.
Yeah, I hope I'm like defining it correctly. At least that's what it was for me.
Yeah,
That
that's
something that wouldn't
all right.
kick
I
me
won't
down
hold
so
you
bad did.
to it. Thank you.
Okay, so we're closing in on the very end of our time, but I would like um, if each of you, if you have something in mind, a resource that you wish everyone knew about, is there anything that comes to mind?
Mm,
And I have one while you're thinking. 988. So 988 is a nationwide, there's the Lifeline, and you can reach that. You can look at that online, by text, by call, and you can call that number if you're concerned about someone, also to get advice. So I just want to let people know about 988.
I'll second that. I've actually called them here at work, concerned for library patrons. And they've like checked in with me, like, well, how are you doing? And I'm just like, no, I'm no good. And like are trained to de-escalate me trying to help someone else out. Um, yeah, great resource. And the Trevor Project.
Okay. Rich, do you have one to?
I'm checking in with Nicole about this.
Okay.
She's the resource queen.
It's
Okay.
so hard as I'm like trying to think of things national. If you were asking for mass specific, a few come to mind. Um, I kind of just laughed at Rich, and I know he's probably rolling his eyes inside his head right now, but Recovery Cafe Network has cafes throughout the US and Canada. So
Okay.
they're really good peer support centers, if nothing else, for people to kind of go and build, some community and connection. And if nothing else, I'm sure state specific, each cafe would have, what someone's looking for, but the cafes are definitely an amazing resource.
Yeah,
Yes.
right. The Recovery Cafe Network, they also, the model is just so beautiful. Like, they also, similar to the Recovery Coach Academy, they, everything just resonated so beautifully with me because it's just pure love and compassion and understanding. And So in any state or, within a reasonable commute, if someone can get themselves into a recovery cafe, they're not going to be loved more or fed better or, helped more.
That's a great resource to know about. Thank you so much. And we are at the top of the hour, so I just want to make sure that people that would like to fill out that evaluation to claim CE, Margo, if you could go ahead and drop that link in the chat just so people have that if you need to go. I am going to just go through a couple quick slides, but again, if you need to go, if you could take that link, we understand if you need to go. Again, thank you so much. Emily and Rich, we are so appreciative of the important work that you're doing and for your willingness to share about that work with us today. Again, I've created a handout with links to some of the resources that were highlighted today. Margo, when you get a chance, if you could also drop that link to the handout in the chat. On that handout, there are some links to Medline Plus pages as well as some NNLM resources. The NNLM Reading Club has featured books on both substance use disorder and alcohol use disorder. These are materials that can be used to host a book discussion related to recovery in your library or organization. They include featured books, discussion guides, and marketing materials, as well as health information resources. I have also included in that handout a link to our next Providing Mental Health Resources in Your Library class, which is going to be offered this Thursday, October 9th. If you're not already receiving Region 7's Week Today, thank you again to our presenters. And again, we're so grateful for your work and your presentation, and take care, everyone. Bye-bye.
Thank you, everybody.
Thank you.